see a short video on this. Okay, any doubts you can ask later. Okay.
Hello and welcome to this breast self-awareness time. This will help you to know the symptoms of breast cancer and help you to take note of important information which you will share with your doctor. Let's get started. Why is it important? Self-breast examination is important for early detection of breast cancer. To detect any abnormalities in the breast so that we can know of any symptoms of the cancer early, which will help us avoid complications in future. What is the right age to start this examination? You can start it at home every month for the women aged 20 to 40 years and every 3 years at the diagnostic centers. For women aged 40 years and above, you have to examine every month at home and once a year at a diagnostic center. Let's go to the other part. Women who are having a history of breast or ovarian cancer should start clinical breast examination at least 5 years before from the age it was first detected. Best time for the self-examination is between 3rd and 5th day of cycle, and for non-menstruating women it should be done on the same day every month. So, what are the ways of self-examination, inspection, and standing position? First,
So this point, please remember, you all are menstruating, right? So 3rd and 5th day is for you. But for your mothers or any senior woman who is not menstruating now, okay, because she is in a menopausal state, so she can select any day of month. Okay, for example, 8th on 8th of every month, she may examine her breast. Okay, that is the thing. Now this is an inspection.
keep both the hands pressed on hips. Next, both the hands behind your head, and next, both the hands hanging sideways.
These are the 3 positions in which you are going to see your breast in the mirror. Okay? So all these positions are important.
So what to note when you are seeing your breast in the mirror? See for any color changes of the breast. See for the skin changes and thickening of skin. See for orange appearance of the skin. Next, what to note? More important points. Any ulceration on the breast. Any asymmetry in shape and size of the breast which happens suddenly, and sudden discharge from nipples, from one or both nipples. Primary things to note again is any other change of the nipple or the inverted nipples.
What are inverted nipples? So normally our breast
Stay up.
nipples are outwards.
काय
Correct? So if
मी
the
का?
nipple is inverted, अगर वो अंदर की तरफ खींचा हुआ है, then it is a problem. Okay? So it means that there must be a lump in the breast beneath which is inverting the nipple. Okay? जो nipple को अंदर से खींच रहा है. So it is a very important sign to know. Okay? Similarly, a lump in the breast, if it's very much visible, anything in the neck, axilla, if it is visible, any swelling, please note that. Okay?
Breast lumps
how you have to apply a series of pressures on every area of breast. Okay.
With the breast tissue. Next, we'll now go through the palpation process. This pressure applied on the breast has to be applied in 3 times: superficial, intermediate, and deep. All these 3 pressures are very important while examining the breast. Do not skip any area of the breast while examining. The palpation process has to be done in standing, sitting, and sleeping position. We have to touch the breast, palpate all the areas of breast, and at the last, see the nipples or any discharge. We'll see the 3 techniques of palpation. The first one is the circular technique. Next is the radial method, and third is the direct method. The first method, we will examine the breast with a circular motion. In the second method, the breast is divided into spoke-like areas, and we will start from the outer area of breast towards the nipple. In direct method, we will examine the breast in up and down.
Okay, so these are the 3 ways where we are going to palpate the breast. Okay, so this is the first technique. Okay, so you are going to palpate the breast in circular motion. Okay, हमेशा बाहर के साइड से अंदर निपल की ओर आना है. Okay, this is the first technique. Second technique is the radial spoke method. बाहर के साइड से अंदर आना है like the spokes of the wheels. Okay, here also you do not have to skip any areas of the breast. This is the third technique. You will start from the uppermost area and then go on palpating this way. Okay, so these 3 methods are there. You can use any one method, but be consistent with what method you are using. Okay, fine. So I think this much video is relevant for today for the breast examination. So by this you will get to know if there is any small lump, if there is any pain in the breast while you are palpating. See the axilla, see the neck. Okay, and if there is any abnormality detected, do not hesitate to go to the doctor. Now why I am making this statement? Because 75 to 80% of the breast cancer, breast lumps are not cancerous. They are benign. Okay, so there is nothing to worry about breast lumps. Okay, you detect something, you feel an abnormality, you have some suspicion in your mind, go to the doctor and get yourself examined. Okay, so now you can do a sonography of breast, correct? Because mammography is not indicated at your age, but if it's with your case with your mother, then she can go for a mammography also, correct? So mammographies you have to do from the age of 40 annually. Okay, so no matter you can do any time in case of any suspicion. Okay, if anybody in your family has a history of breast or ovarian cancer, then you will have to meet your doctor immediately because there are some testings that you have to do at an early age. Okay, so please keep that in mind. Okay, in short, this was about the breast cancer examination. So if you have a lump in the breast, what we as a pathologist do is we take the cells out from the breast. Okay, we examine them under the microscope, or we take a biopsy from the lump and we see it under the microscope. Okay, that will diagnose the nature of the lump. Okay, that's it for the breast cancer. Now, something about cervical cancer. Do you know what is cervix first of all? Okay, so with that, we have something which is called as a uterus. Okay, then the mouth of the uterus is the cervix, correct? And then cervix opens into the vagina, correct? on that. Okay. So cervical cancer, please tell your mothers also. And HPV vaccination, please, if you have not taken, please get it done. Okay. Madam will tell you about the HPV vaccination also. Correct. Another thing which you should get vaccinated is rubella. Have you heard about rubella? Yes. Oh, that's great. So rubella का हम लोग vaccination normally ले लेते हैं. It is an MMR vaccine which is given at 12 to 15 months of age. Normally it is given. But if you have missed that vaccination at that age, then you can take it even now. Okay, it's called as a RVAC vaccine. Okay, it's a single dose vaccine. You can take it even now. And in the women of childbearing age, so it is very, very important. So today, please check whether you have taken MMR vaccines or not. Okay, HPV vaccine, if you have not taken, please schedule it as early as possible. Okay, so rubella vaccine you cannot take in pregnancy because it's a live vaccine. Okay, and avoid the pregnancy has to be avoided 28 days after you take the RVAC vaccine. This is for information of even the other young ladies whom you will come in contact. Okay, this was in short about rubella. Madam will explain in detail about rubella and cervical cancer also, and most important PCOD. Thank you so much.
Thank you so much, Dhruva ma'am. I guess सबको पता चल गया होगा कि how to examine the breast and all. So now I would like to call Dr. Kavita madam. She is gynecologist from Kalyan. Ma'am, please.
Thank you. Before this goes on, एक homework मैडम भी दे रही है और मैं भी आपको दे रही हूँ. Everyone has to go back and check their vaccination schedule का chart. What vaccination you all have taken? मम्मी ने बहुत precautions लिया है, पर कभी miss हो सकता है. So just check out what vaccinations you have taken. So you will have to do a lot of things. Hep B vaccine है, MMR है, tetanus है, BCG है. Okay? So this you all should be aware of. Now before we start off, how many of you get scared with an injection? Injection से लड़की है, मैं तो डरती हूँ. फिर बिंदास बोलो. बाकी सब brave है, क्या बात है? So ये lecture इनके लिए बहुत काम है, हमारे लिए बड़ा काम है. Now what I want to tell you, which language you are comfortable? English, Hindi, Marathi or combination? Combination. Okay बेटा, I am very happy. तो स्वतः हम बोलिए मराठी. I combine. मराठी सबको थोड़ा थोड़ा आता है, हिंदी सबको ही आता है और इंग्लिश सबको ही आता है. ठीक है? Let's combine. ये चले तो अच्छा है, नहीं मुझे बहुत सुनना पड़ेगा आपको. How many of you know PCO? PCO किसको पता है? क्या होता है बेटा PCO? Yes, yes, yes. और खांसी फ्लू हुआ? हर साल फ्लू होता है, सबको ही होता है. Because वो वायरस है ना, वो चेंज करता है खुद को. So आज मैं अगर वायरस का बेस वैक्सीन बनाऊंगी, next year the virus is changed. So flu vaccine, flu virus everybody knows. Same like that, human papilloma virus is a virus. This virus is very notorious. First of all, I would like to thank Archana madam for calling me here and complete. Of course, our favorite madam sitting here. Along with that, Birla College and the complete group. Let me tell you one thing. I was so happy. ऐसे लगा मैं थोड़ी देर के लिए college को चली गई. The way you were introducing, the way you were appreciating yourself, and believe me, I was sitting like this girls are. I must appreciate the way you all are talking. Tomorrow you are going to be on this side, okay, and our kids, our grandkids are going to be on that side. Okay, so you have to be very clear about some things. Why we are both are here. आज हम अपने लिए हैं, अपने लिए खड़े हैं इधर. हमें अपना सोचना है पहले. Girls have a different attitude. एक लड़की सीखती है, पूरा घर सीखता है. मैडम ने यही बोलने का कुछ bladder, पेशाब की थैली, and पीछे है motion की जगह, that is intestine, rectum. So this uterus is coming with their friends. ये मैं बार-बार इसलिए बोल रही हूँ क्योंकि ये uterus में प्रॉब्लम कर रहा है तो साथ में दोनों को भी लेके चलता है कभी-कभी, या फिर फ्रेंड्स बोलते हैं हम भी आ रहे हैं तेरे साथ, आगे ये प्रॉब्लम आ सकता है ना। ये सारा बोलने का एक ही लॉजिक है, ये हम लोग क्यों बताना चाह रहे हैं कि everyone here should be realizing brain is very important. Brain is taking care of everything. Orchestra of our hormones goes on in the brain. Pineal gland, okay, gland है जिसे pineal gland बोलते हैं, वो सारा काम कर रही है। आज हम लड़की है, अपने hormones बराबर चल रहे हैं, that is because of the pineal gland. अभी इसको ना हम लोग बहुत we are in a problem, you know, हम लोग को मस्ती बहुत ज़्यादा टेंशन लेती है लड़की। Compared to boys, girls take lot of tension. टेंशन लेती है, क्या करती है? बहुत ज़्यादा स्ट्रेस ब्रेन को देती है। अगर आप नॉर्मल ब्रेन को बहुत ज़्यादा स्ट्रेस दोगे, everything is going to get disturbed. So your menses is going to get disturbed. So your hormones are going to get disturbed. Your thyroid is going to get disturbed. Your prolactin is going to get disturbed. ये hormones हैं जो अपने बॉडी में सब इक्वल रखने का कोशिश कर रहे हैं और आप स्ट्रेस से उसको डिस्टर्ब कर रहे हैं। So first medicine is you be stressless. How to be stressless? Let's try to see this. Okay, now you have everyone. You have mother, you have sister, you have aunt, you have teacher, you have granny to explain everything. And जो कुछ बचा है वो डॉक्टर कविता बता देता है. Okay, now comes मैडम ने हमने रुबेला कवर किया है. रुबेला हम लोग बार-बार कवर करने की कोशिश इसलिए कर रहे हैं. Why we are saying go back and check your vaccination schedule? Because if you have not taken this MMR vaccine, so you have still one chance to take this vaccine. And you can protect something which is called as rubella syndrome. ये क्या होता है मैं बता रही हूँ. Ideally rubella एक infection है जो बहुत अलग से present करेगा. 50% people will not even come to know कि उनको rubella हुआ है, लड़कियों को समझ में नहीं आएगा. They are suffering from rubella. Okay. Some people will come with flu-like symptoms, like बुखार आया, conjunctivitis हुआ है, running nose हुआ है. Some people, some of them will present like with this rash. We generally start on the face, come on the neck, and then it goes to the extremities. ये कुछ भी हो, ये याद रहे. ये रैश आने के पहले 7 days पहले और रैश आने के 7 days बाद, person is infected. आपके पास बैठा होगा रैश आई है तो आपको पता चलेगा. मगर if रैश आया नहीं है, नॉर्मल सर्दी खांसी है, और if your immunity is very strong and you don't do anything, person sitting next to you is suffering from rubella or not, she is spreading the infection to the other person. So you have to be careful. Why we want that? We want to confirm on this vaccination today. एक वैक्सीन से आप क्या बचा सकते हो? एक लाइफ बचा सकते हो. We all are going through the phases of life. We all are going to get married, definitely, and we all want एक new life आती है वो बहुत संभल के आए. Because there is our life जिसको अपने को independent करना है, dependent नहीं. What happens when you are suffering from rubella? When a mother if you are in reproductive age और आपकी शादी होने के पहले आपने अगर रुबेला वैक्सीन लिया नहीं होगा, and suppose if you get your immunity is not good, ऐसा जरूरी नहीं कि सबको रुबेला होगा, मगर मैक्सिमम होने का चांसेस है. And if your immunity is not good, आपको क्या होगा? आपको इन्फेक्शन होगा. आपका इन्फेक्शन किधर जाएगा? बच्चे में जाएगा. कैसे जाएगा? यूट्रस से प्लासेंटा से वो बच्चे के पास लेके जा रहा है. ब्लड जा रहा है ना बेबी के पास, तो मदर का ब्लड वायरस भी लेके जा रहा है. Once a baby को क्या है? बेबी स्मॉल है, बेबी इज डेवलपिंग. एक छोटा सा सेल डिवाइड हो गया, हाथ बन गए, पैर बन गए, कान, सर, ये सब डेवलप होते हुए जब अगर वायरस ने अगर हिट किया तो व्हाट यू गेट इज रूबेला सिंड्रोम. व्हाट यू गेट, अ मदर कैन हैव प्रीटर्म डिलीवरी, या बच्चा पेट में चला जाता है, या अबॉर्शन हो सकता है. और अगर बच्चा बच गया तो बच्चा कैन प्रेजेंट विद दिस सॉर्ट ऑफ सिम्पटम, जहां ब्रेन इफेक्ट होता है, जहां आईसाइट इफेक्ट हो सकती है बिकॉज़ ऑफ द कैटरैक्ट, कंजेनिटल कैटरैक्ट, और योर हार्ट कैन हैव अ प्रॉब्लम. दे आर रिपोर्टेड एज पीडीए, पेटेंट लेप्टस आर्टेरियोसिस. या बेबी व्हेन बॉर्न, सब एक्सपेक्ट करते हैं अपना बच्चा बहुत प्यारा दिखे, बट द बेबी कैन कम अप लाइक दिस, एंड देन यू कम टू नो, ओह आई एम नॉट टेकन. ये सिम्पटम शायद स्किन सिम्पटम यू विल नॉट सी ऑन द सोनोग्राफी. हाँ, हार्ट एंड ऑल विल बी एबल टू सी इजीली ऑन सोनोग्राफी, बिकॉज़ जनरली ये कंबाइंड इन्फेक्शन होता है, रूबेला इन्फेक्शन होती है, हमको समझ जाता है होगा दिस फीमेल इज इन्फेक्टेड, एंड वी जनरली एडवाइज देम टू abort. But abort is not very easy for any girl. Abortion is not very easy. Okay, so why to go for that? एक छोटा सा वैक्सीन ले लेते हैं ना, we can prevent this. Let's see one small vaccine. If you are not taking गिरते पड़ते रहते ही हैं। Now let's come to our another main topic is PCO. I'm so happy. Let me be very clear with you. मेरे यहाँ maximum लोग जो देख रही हो ना, they have very good weight. We call as BMI, body mass index. Comparatively, all are maintaining well. मगर ये maintaining well है एक level limit के बाद हम लोग छूट जाते हैं. तो छूटना नहीं है अपने को. Why? Is what we want from you is all this. I don't want everybody should do it in only studies. Anybody can do it in any field. Not necessarily बढ़िया पढ़ाई भी अच्छा रहना चाहिए. But what we are seeing now is we are seeing this. Look at the baby weight sitting in that basin. Look at this motu baby. 10 साल का बच्चा है मगर वेट 5 किलो का है. आजकल ऐसे मिलते हैं हम लोग का सच चाबी बेबी. आगे क्या होने वाला है पता है? And now vada pav is replaced by French fries. You know, cheesy French fries, peri-peri French fries. So what you are going to get if you eat that sort of food is PCO. You have all have seen Mona Lisa was the most beautiful picture which we all aware of. But imagine अगर Mona Lisa अपने एज में होती, आप लोगों की जनरेशन में होती, तो क्या Mona Lisa भी ऐसे हो सकती थी ना? If she would have been not maintaining her diet or anything like that, she with the beard, okay, she with the hoarse voice. Okay, we don't want this because PCO का presentation है, PCO and PCOD. Let me tell you, it's a spectrum. PCOD is one spectrum and PCOS is another spectrum. Disease यानी polycystic ovarian disease, ovary का disease जो हार्मोन को imbalance कर रहा है, cycles irregular ला रहा है. PCOS is a syndrome where the metabolic things are operating. यहाँ हमने cell metabolism effect हो रहा है and we are naming it polycystic ovarian syndrome. Now what actually happens? She has very rightly said. 3 important बातें होंगी. What? Period irregular. किसी को बहुत irregular excessive periods आते हैं, किसी को बहुत frequent period आते हैं, किसी का period रुकता ही नहीं है, maximum लोगों को delayed period आते हैं. Okay, so delayed period आना तो be clear about one thing. Once first you get your first menses, that is called as menarche. जो पहला period आता है उसको हम menarche बोलते हैं. किसी को 11 years में आएगा, 12 years में आएगा, 13 years में आएगा. Now what we are seeing nowadays, लड़कियों को 8 years में भी आ रहा है. So things are changing. So you have to be alert. कुछ बातें lifestyle changes करने ही पड़ेंगे. There is global lot of things are changing in the world. Now what happens is if you are getting irregular cycles, first period आने के बाद 2 साल period normalize होने को वक्त लगता है because your brain has to stabilize. मगर 2 साल के बाद भी अगर ऐसा प्रॉब्लम आ रहा है या within 2 साल बहुत excessive bleeding हो रहा है, बहुत ज़्यादा ब्लड आ रहा है, please consult your doctor. Please tell this to your mother. She'll take you to the doctor. एक बार देख लो, ऐसा नहीं हो कि you are on that spectrum of PCO. Other thing what you can have is excessive weight gain, and you have a male pattern obesity, and a male pattern fat distribution, and male pattern hair growth. लड़कों को यहाँ का beard होता है, okay, mustache होती है. ये अपने को आना है. क्यों? Because hormones are changing inside. Estrogen की बजाय testosterone बढ़ रहा है, and testosterone is giving a male pattern, hair pattern along with hair loss here. Yes, hair loss भी काफी होता है. Along with अगर आप लड़कों को देखो, fat लड़कों को पेट बड़ा हुआ है, arms बड़े हुए हैं. Male pattern. Okay, this is called as male pattern obesity. What we want is, see, अगर PCO हम अगर control नहीं करते तो what we are going to land up with is PCOD control नहीं करते PCOS, जहाँ आगे जाके क्या होगा? ठीक है, आज मैं मोटी हो गई हूँ, कल मैं एक्सरसाइज करके काम कर दूंगी. ओके, आप कर दोगे, मगर होगा क्या आपसे? आपके लाइफ के स्ट्रेस बढ़ने वाले हैं. आज 10th 12th हो गया, आपके बाद में आपके एम्बिशंस बढ़ने वाले हैं. कुछ ना कुछ टारगेट्स आपके सामने काफी आने वाले हैं. along with the family. You cannot forget your family. तो ये सारा रहने वाला है. Do you have time to do exercise? No, but you have to do it. You have to take out time for yourself because otherwise you land up PCO. आगे जाके क्या कन्वर्ट होता है? मेटाबॉलिक चेंजेस होंगे या यूरिक द स्पेक्ट्रम. You get hypertension, you get diabetes. Okay. Now PCOD cannot be cured. Let me be very clear. Cannot be cured. But yes, it can be controlled. वो कंट्रोल आपके हाथ में. वो कैसे करते हैं हम लोग? ऐसे. ये तो बहुत बोरिंग लेक्चर हो जाएगा, तो मुझे बोलना पड़ेगा. डाइट, न्यूट्रिशन. ओके. Okay. So what do you mean by that? Balance. आपका balancing जब से पैदा हो गया तब से चालू ही है. Do not forget that. You cannot run around like, okay, I am in my college, I am enjoying. No, you have to balance your life. Here comes exercise. Why you should do exercise? क्यों करना? I know आजकल बहुत लोग they get up. If I ask you, what time you get up at? 5 a.m. What do you do after getting up? Very good. I am finding a very good girl. What are you doing? Be whatever is there, whatever you are doing. What time do you get up? Oh, so nice. What do you do? Get ready for the college and all. Okay, no problem. That is what I want to stress. थोड़ा सा वक्त निकालो exercise के लिए. What is going to do? It's going to regulate your weight. It's going to give you self-confidence. You are going to improve your mood. नहीं तो ऐसे हो क्या college में और एक please do not read it. पढ़ना है. नींद आ रहा है. Okay? So exercise is going to change your mood. तो lack of exercise क्या करेगा? अगर आप exercise अभी तो आप fit and fine लग रहे हो, अगर अंदर क्या हो रहा है शायद आपको पता नहीं. अगर आप stress कर रहे हो तो समझेगा your body is becoming stiff. You need exercise. You need stretching. नींद बराबर नहीं आती. नींद बराबर नहीं आने का दूसरा कारण Instagram and Facebook है. लोग क्या बोलते हैं? More circulation to the complete body. Weak muscles. You are not developing your muscles. देखो काम करेंगे तो brain काम कर रहा है. You are going to the heights. What about your body? Muscle strengthening चाहिए आपको. Then easy पढ़िए. बार-बार weakness लगेगा. पढ़ाई. Only you can study. If you are given the next challenge, you will say no, mama, मेरा पढ़ाई मुझे पूरे नहीं. Why can't you take the next challenge? You are not smart enough. Now, what exactly you should avoid? I'm sorry to say, but yes, you have to avoid this. Pizza, burgers, dairy drinks. आजकल new concept निकला है. Cocktail ले, then you will have mocktail. Virgin Mary we will have it. Okay, dairy drinks से आगे चले गए हम लोग. So now please avoid this. This is not good for your health. French fries फटाफट. Let's be very clear. Very good please यार. अगर मैं यहाँ आके ये बोलूँगी ये बंद करो, वो बंद करो, you will say madam, दरवाजा खुला है, निकलो. So let's do one thing. One cheat day is allowed. Okay, when you start doing a cheat day, you want a cheat day in a week is also allowed for you because you are youngsters. आप अगर एक cheat day करते हो ना 6 days चुपचाप control कर लो. अरे one cheat day is there with me. I can do whatever I want, isn't it? Now, what you should have? ये मम्मी बोल के थक गई है. अब मैं क्या करूँ? Let's try it. हाँ. Now there are girls like this also who are eating so much. I mean, they're getting so much conscious about their health. कि नहीं मुझे PCOD नहीं बनना है, मुझे weight नहीं बढ़ाना है, मैं मोटी नहीं हो जाऊँ, मुझे jeans tight नहीं हो जाए. So what they do, you know, खाना तो है, friends तो है, temptation तो हो रहा है, सब गिटी. Okay, फिर बाद में घर आने का बाप रे मैंने क्या खा लिया? Mama, I had so much. Going to the bathroom and vomiting it out. Induced vomiting. I don't want anything to absorb हो गया तो there is something called as anorexia nervosa where the girls are so conscious about their health that जो कुछ खाते हैं वो निकालने की कोशिश करते हैं, खाना ही नहीं खाते बराबर. So how you are going to make your proteins, fats and minerals? You are not going to get it. You are going to land up with this. We don't want this also. Please, you all are the future. ऐसा future नहीं चाहिए. Okay, healthy foods. Let's come back. Never skip meals. Have proper breakfast and early dinner. बहुत घर में लेट डिनर होता है बिकॉज मम्मा टीवी देखना है, मम्मा पढ़ना है, तो ये लेट डिनर का ये रीजन है. लिमिट फास्ट फूड. एज आई टोल्ड यू चीट डे इज अलाउड. हैव एटलीस्ट वन फ्रूट अ डे. वन फ्रूट डजंट मीन वन grape. प्लीज डू नॉट चीट yourself and do not cheat me. One proper fruit. Okay, have salad and vegetables daily. I don't want to cover this. If you have any questions, you can ask me because acne is one of the presentation of PCOD. आप लोग इतने young हो, we all are cautious about your health. Let me tell you one thing. I want to look graceful. Forget about Deepika Padukone and all. I don't care. I myself am beautiful. ये ऐसे ही चलना है आप. Don't compare yourself with anybody. You yourself, you are beautiful from the time you are born to the time you are going to go to the age of 99 also. अभी 99 जाने के लिए मेहनत कर रहा है, तो मुझे पता नहीं होगा. So how what are you going to do? You are going to take care of all small today. Regular exercise, lifestyle modification. अपने problem क्या है? We get acne in this age. This is again because of the hormonal changes, oily skin. So if you do your diet modification बाद होगा, ठीक है ना? मेरी सेक्सुअल एक्टिविटी इधर पे है, कहाँ होगा? Wait, something is close. Most sexually active men and women may expose to the virus at some point during their lifetime में एक बार कभी किसी को exposure होने ही वाला है. But if your immunity is very good, you will come out of it. Okay? There is an increased risk at younger age because why the sexual activity is more here? More prevalence at young age, 15 to 25 years. Then more is there only one virus? There are 200 or more than 200 viruses. उसमें से 30 to 40 viruses हैं जो genital organs को affect करते हैं. काफी सारे वायरस बॉडी में कहीं ना कहीं इफेक्ट कर ही रहे हैं. HPV can cause similar type of cancers. I'll come to that. How does it spread? This is very important for you. Two individuals sexually active could result in HPV. Sexually active individuals. Then it can spread through vagina, anus, oral, or skin to skin close contact. Okay. Now it's most commonly spread vaginally. Most common is anal or vaginal sex. It also spread is close skin to skin touching during the sex. Okay? इसमें kissing भी आ गया. Okay. A person with HPV can pass the infection to someone even when they have no signs of symptoms. I'm absolutely fine. मुझे कहाँ से होने वाला है? तो मेरा पार्टनर वो भी बहुत फाइन है. ऋतिक रोशन है. पर पता नहीं HPV कैरी कर रहा है. Okay? The symptoms can develop years after having sex. पहले हम लोगों ने कुछ तो sexual activity हो चुकी है. See, I'm talking this. Let me be very clear. We are human beings. Okay? These are all things we are going to get exposed. But now use your brain. कौन सी बातें कब करनी चाहिए ये समझना है आपको. There everything at the right time. I'm not saying sexual activity is bad, but then there has to be right time. You should know what is best. How do I protect myself first? ठीक है? एस्ट्रोजन प्रोजेस्टेरॉन लड़कियों में भी है, टेस्टोस्टेरोन लड़कों में भी है. ऐसा नहीं है कि लड़कों में ही है. अरे लड़की सीटी बचाओ, लड़कियों को भी लगता होगा, आसपास होता होगा. But then what they do पटाख से no I have to tell you. Girls are very smart compared to boys. वो बहुत जल्दी से उनका डैमेज हो रहा है माइंड का. लड़कियां बहुत स्टेबल रहती है maximum times. I'm not saying every time. Now what you have to do, you have to be careful about. Now आज रिलेशन हुआ और मेरी शादी हो गया 10 साल के बाद. एंड 10 साल 15-20 साल के बाद समझ में आया ओह आई एम हैविंग सम प्रॉब्लम, माय डिस्चार्ज हो रहा है, कुछ तो ब्लीडिंग हो रहा है. एंड इन्वेस्टिगेट किया तब समझ में आया ओह आई हैव HPV इन्फेक्शन, मुझे कैंसर है या कुछ वॉट्स जैसे आए. क्या है मैं वो समझाती हूँ. That time you cannot blame your husband. We don't know who's the partner. We don't know anything. कब एक्सपोजर हुआ है, कब कैसे हुआ है, हमें पता भी नहीं है हमको कब इन्फेक्शन हो चुका है. This makes it hard to know when a person gets infected, has got infected. Are you going to talk about cervical cancer? No. HPV itself cervical cancer नहीं करता है. It causes cervical cancer, vaginal cancer, vulvar cancer, genital warts. ये क्या है मैं समझाती हूँ आपको. Anal cancer, anal sex, anal cancer, oropharyngeal cancer, oral sex, or kissing, oral cancer, and believe me, boys are also not spared. Anal cancer. Okay? Here is clinical presentation. I feel picture memory बहुत ज़्यादा याद रहती है. मेरी बात कर रही हूँ पर क्या होता है actually तो ये these are warts. Okay, these are warts. My aunt is not coming. आपको समझ में आया है? You are getting this lumps. These are warts. Okay? मैंने male female दोनों को combine किया है so everybody should come to know it is not only for females. Even boys get affected. Now these are warts. This is a benign infection. Accepted. Human papillomavirus का benign वाला low risk वाला virus ये कर रहा है. And this is cervical cancer because of the high risk viruses. Stages of cancer there are stage 1, 2, 3, 4. Let's not go into it. Now there are two types. There are these 40 viruses which are there which we are talking. Are divided into low risk and high risk. Low risk क्या करेगा? Warts देगा. ठीक है? High risk warts देगा इसका मतलब क्या है? You can infect the other person also. आप कैरी कर रहे हो infection हो सकता है. क्या आपका immunity is taken over. Second is high risk यानी कैंसर करता है. जो अभी हमने बताया oral, cervix, anal cancer ये cancers करता है. Why we are talking about low risk, high risk? Mainly low risk viruses are 6 and 11. ऐसे तो बहुत है मतलब बहुत commonly देखे गए 6, 11 and high risk देखे गए 16, 18. I'm stressing on this number because अपना vaccine इनसे बना हुआ है. ये बातें क्यों कर रहे हैं हम लोग? Why we are talking about cervical cancer? हम लोग तो सब healthy है. Why we are talking about cervical cancer? Look at this. What we are not aware of. Women at risk for cervical globally 17%. Almost 51.15% crore people population is getting exposed to cervical cancer. Okay, they are at risk. Annual number of cervical cancer cases is 1,24,000, and annual number of cervical cancer deaths globally is 23%. That is coming to 70. इसका मतलब one death because of cervical cancer every 6 minutes, according to this calculation. You can find out. It's probably coming to 6 days for 8 death होता है cervical cancer. So we have to take care of this cervical cancer, which we can take care of. What do we do? सतर्क रहो, सुरक्षित रहो. ना ठीक है, cervical cancer होना है इसका मतलब sexual activity जिंदगी में नहीं करें क्या? No. HPV infection is spread to infected genital skin, mucous membranes or bodily fluids and can be transmitted through sexual intercourse, including oral sex. Now, most common infections are asymptomatic. समझ में नहीं आएगा आपको infection हुआ है. Most common asymptomatic, and 1 to 2 साल में अगर आपका immunity sexually strong हुआ तो it will resolve. Okay, interval between acquisition of HPV infection and progression of disease is आज मेरा exposure हुआ. When I'm going to get infected 15 to 20 years down the line. So it's a long time. We are not aware of this. What we are taking for your future. So be cautious. So cervical cancer, how do we present? कैसे present करते हैं? अपनी लड़कियों में बहुत common problem होते हैं. Even if you go at home, आप ये common सुनते हैं. White discharge हो रहा है. सफेद पानी जा रहा है. Everyone maximum comes up with that problem. Try to find out whether there is a normal white discharge or there is an abnormal white discharge. I am not talking on this because वो lecture काफी बड़ा हो जाएगा. But white discharge should not be taken lightly. Okay? White discharge, abnormal vaginal bleeding, painful intercourse, relations रखते हुए pain हो रहा है, painful urination or bleeding after the intercourse. You have to be careful about. Do we have something for cervical cancer? Yes, we have. We can prevent it. We can prevent it by three methods. What? Education and awareness, screening and vaccination. Okay. Now, education and awareness का क्या status है अपने इंडिया में? ये देखिए. The people are not aware. How many people are actually aware? Forget about you. at least आप लोग स्कूल में आते हो, बातें करते हो. पूरे फैमिली में मम्मी ने आपको बोला है या आंटी ने आपको बोला है पापा सर्वाइकल कैंसर है या ऐसा रहता है, इससे ये स्प्रेड होगा. ऐसे कितने लोग हैं जो सर्वाइकल कैंसर कैसे स्प्रेड होता है, ये इसका डिस्कशन होता होगा. Just raise your hands. So you are understanding. What is this? Less awareness. So people are not aware about the tremendous disease burden caused by cervical cancer. People may lack accurate information. Done. तो बात करने का भी डर है. तो information कैसे मिलेगा हमने? हाँ, तुम लोग. Many women parents are not aware of cervical cancer and do not recognize any early signs and symptoms of cervical cancer. Women at risk may not be aware of the need to be tested. बहुत लोग I am healthy. कैसे करें? I am absolutely fine. कैसे करने की गरज क्या है मुझे? They don't accept it. Reluctance. Now what? Cervical cancer most often found in women who have not been screened with screening हुआ है तो definitely हम treat करेंगे. Isn't it? Screening हुआ ही नहीं, we are going to land there sometime. Okay, we want to stop that. Madam has already explained you pap smear. Okay, pap smear is something where the test is taken, cells are taken from the uterus थैली के मुंह से, cervix से. ये डरने वाली टेस्ट है, ये हम लोग ओपीडी में करते हैं. Don't be scared about it. It's a normal test. ठीक है? to cover this vaccine. अभी अगर ये ब्लड में नहीं जाता है तो वैक्सीन क्या करेगा? ये कॉमन सेंस का क्वेश्चन है, नो डाउट अबाउट इट, बट यू आर नॉट अवेयर वैक्सीन क्या करता है? वायरस लाइक पार्टिकल का पार्टिकल टेन वायरस एक पार्टिकल उसका एक पार्ट लेके उसको वैक्सीन करता है। तो वो वैक्सीन क्या करता है? जब हम लोग देते हैं अपना इम्यून सिस्टम रिकॉग्नाइज करता है दिस इज समथिंग फॉरेन, वो इम्यूनिटी बढ़ाता है और इम्यूनिटी स्प्रेड्स ऑल ओवर द बॉडी। तो वैसे ही अपने सर्वाइकल टिश्यूज पे भी जाने वाला है। अगर इसके बाद में वैक्सीन देने के बाद अगर अपने को इन्फेक्शन हुआ, अरे आईवी आर गेटिंग एक्सपोज्ड टू द ह्यूमन पैपिलोमा वायरस, तो क्या करेगा ये वैक्सीन, ये एचपीवी वैक्सीन, ये जो एंटीबॉडीज बना रहा है, ये कोई सेल इम्यूनिटी बना रहा है, वो वायरस को वही ब्लॉक कर देगा। सो वायरस विल नॉट गो इन योर बॉडी, इट विल नॉट गो इनटू योर लोकल सेल्स आल्सो। सो देयर इज द इंपॉर्टेंस ऑफ एचपीवी वैक्सीनेशन. HPV vaccine should be given to females before they reach an age when the risk of HPV infection increases. What do you mean by that? Before the sexual activity. Very clear. Before the sexual activity preferred लेते तो बहुत अच्छा है. HPV vaccine should be ideally given between 9 to 26 years, and HPV vaccine is given in 2 or 3 doses. See, 2 or 3 doses will come to 2 doses when you are between the age of 9 to 14 years, and 3 doses your age and up. Okay? The virus vaccination का schedule 6 months के अंदर खत्म हो जाता है. Believe me, it's not very painful. So even I realize कि ये बहुत painful नहीं है, ये injection लेना ही पड़ेगा. So आप लोग भी टेंशन नहीं लो, इस वायरस एक इंजेक्शन को डर के हम लोग एक डिसीज को पास में ले रहे हैं. The mode of administration intramuscular and not for any blood में नहीं देना, सीधा मसल में देना. This antivirus का injection. So don't get scared about it. Multiple companies, 2-3 companies have come up with a vaccine. One is gone because Cervarix was coming up with a GSK was coming up with bivalent vaccine. अभी bivalent, quadrivalent, manivalent, these are the type of vaccines. जो 4 virus में बार-बार आपको 26, 11, 16, 18. These are the viruses which are taken up by the vaccine people and they have created a vaccine for doing this because ये 4 viruses almost 90 to 95% of cervical cancers देते हैं. अगर हम लोग इतना भी दे वैक्सीन तो एटलीस्ट हम उसको प्रोटेक्ट हो गए. हम इसका मतलब नहीं, ऐसा नहीं होता है कि हम यार 100% प्रोटेक्ट, 5% स्टिल चांसेस देयर तो अदर वायरसेस है. अगर वो एक्टिवेट हुआ उसका हुआ बट जनरली 95% वी आर कवरिंग ourselves with a quadrivalent vaccine. Nanovalent vaccine भी आ चुका है which covers 9 viruses. I would say 95 से 97% जा रहे हैं because ये 4 virus maximum cancers देते हैं. Another viruses gives the cancer, chance of giving the cancer is less. We screening enough for preventing cancer. आप ऐसा बोल रहे हो स्क्रीन करो, चलो हम लोग सभी स्क्रीन कर लेते हैं. ऐसा होगा तो बहुत अच्छा है. तो इंडिया में क्या स्टेटस है देखो. True, that screening is very important for cervical cancer prevention, but only 3.1% of Indian females are undergoing screening. Why? Reluctance. मैं अच्छी हूँ, कोई प्रॉब्लम ही नहीं. Except me, but we should take care of ourselves. Now, 5 reasons why vaccination is better at a younger age. आपके यहाँ लेक्चर क्यों रखा गया है? Why we want younger age? Is first reason vaccines are for prevention, not for treatment. Treatment नहीं है. बाद में क्या करोगे क्या? You have to prevent it. Second, immune response is very good at administration. Your immunity is very strong right now. Now, immunization before the exposure, definitely exposure कम होगा उसके पहले आपने ले लिया तो definitely efficacy अच्छा होगा आपके वायरस पे vaccine. This high risk acquiring HPV even with the first wave. We don't know. Any partner can cause an infection. So take the infection or vaccination early is logic. And cost of immunization is less. Cost of immunization is less. अगर ये इससे हम अब की बात करेंगे. Why I am saying cost of immunization is less? आज मैं vaccine को cost I am spending money. Accept it. See, we go to Shoppers Stop. We go to Zudio. Zudio भी आ गया है ना? Zudio. We go to our all malls and all having food. Right, sure. हम कितना पैसा spend करते हैं? Why don't you spend on vaccine? Okay, which is not going to cost very much. अगर आप पूछोगे तो cost नहीं बोलूँगी, you don't worry. But what I'm saying, आज हम वो cost bear करें, तो आगे जाकर अपना cervical cancer बचेगा, अपना warts बचेगा. इससे क्या होने वाला है? Mental, psychological, social, financial stress कम होने वाला है. Treating imagine one person in the family having cervical cancer, the complete family system. Because ये हमारे लोग हैं, इनको कुछ होना नहीं चाहिए. एक भी बंदे को हुआ ना तो कंप्लीट घर डिस्टर्ब हो जाता है. हमें तो कितना फाइनेंसेस, कितना टाइम जा रहा है आने से बात के लिए आपके. We need to do the vaccine. It's better. These are not covered. Now, why we are talking about vaccine? The quadrivalent vaccine is easily available. Gender neutral. Boys are also supposed to take the vaccine. Why? They are also supposed to cover up themselves for HPV virus. Sexual activity उन्हें बहुत ज़्यादा होती है compared to girls. ऐसे नहीं बोल सकते अभी comparison तो लगा ही नहीं. Boys do the same, but we have to take care of them also. Now what remains? It is cost effective. Definitely, if you think about the proper things, it is really cost effective. Assured supply. Now even in India, the production is there, so supply there is no problem, and very manufacturing. This is for boys, okay, and this is for you all to take home the message, not only girls. Around 1 in 3 men around the age of 15 years are infected with HPV. So they have to also take vaccine. Work on you. What is the work on you? It's estimated that every sexually active person will contact HPV infection sometimes in their life. ठीक है? Barrier method. अभी हम लोग लड़कियां जनरेशन स्मार्ट, ठीक है ना? Condoms वापरेंगे, नहीं होगा हमको. No. Please. Condoms can reduce the risk of transmission, but are not entirely foolproof. We have pores, close skin to skin contact is going to give the infection. Teenage is all about development of your full potential and enjoyment with complete responsibility. And I am mentioning again, complete responsibility. You cannot say, I have just studied, I am studying. No, you are a responsible person. You have to take care of all sides without taking tensions. No stress, please. This is my favorite slide. Why am I here? Media education is need of that. सबको देखो स्माइल आ गया, सबके मुंह पे स्माइल आ गया. But I tell you one thing, this media education sometimes gives the half knowledge and so I am here. Other knowledge नहीं चाहिए अपने. We may get distracted to other part. ठीक है? So if you try to search one thing, you get complete list. And पढ़ते time निकल गया. फिर भी क्या मिला नहीं, I'm getting confused now. Balance is the key of life. We all are balancing our life as doctors. We all are requesting you to balance your life so that you can balance your country so that we are safe. Okay? Thank you.
Thank you so much, ma'am. So all this educational session था, उन्होंने सीखा what is PCOD, what is rubella vaccination, what is HPV, what is cervical cancer, what is breast cancer. तो इतना सब एजुकेशन तुम लोग यहाँ से लेके जा रहे हो, बट इसका क्या यूज है अगर तुम एजुकेशन को बांटना चाहते हैं, ठीक है? तो मैं ये चाहता हूँ, सबको रिक्वेस्ट करता हूँ कि आज तुम लोग यहाँ से जो भी सीख के जा रहे हो, अपने फ्रेंड्स, फैमिली, मदर, सिस्टर, तो सबको ये एजुकेशन बांटो ताकि उनको भी इसके बारे में पता चले, ठीक है? अवेयरनेस फैलाओ. तो थैंक यू कविता मैम, थैंक यू.